Hi, I'm Cheryl Abrigo with USF Tech Transfer. For today's Tech Tour, we're here with Dr. George Blanck, one of our professors at Morsani College of Medicine, Department of Molecular Medicine. Dr. Blanck, it's a pleasure to have you here today.
Thank you.
Dr. Blanck and his team have discovered a new way of attaining a more accurate prognosis for different types of brain cancer. Can you tell us a little bit more about this?
Yes, well, this distinction between patients is based on a very famous protein called tau. And in our case, with the cancers we've studied, we've looked at cancers that are related to the brain, especially lower grade glioma and neuroblastoma. And in those cases, what we have discovered, and by we I certainly mean my students, what we have discovered is that tumors that have high levels of tau, those tumors represent patients who have very long or relatively long lifespans. And so we made the hypothesis that the longer lifspan was due to tau killing off these tumor cells, similar to what tau does in the very famous disease connection, Alzheimer's disease. Tau is a very big player in Alzheimer's disease, certainly well known to kill off neurons in Alzheimer's disease. So we were able to confirm that hypothesis to a certain extent, that these tumor cells were dying more often when we could see high levels of tau. And that did fit the other data, namely that the patients who had the high levels of tau in their tumor were living much longer.
Excellent. So who will benefit most from this technology?
Well, that will get a little bit out of my technical range, but we do hope if we put this out on the table, there are people who know things or work in areas where we don't work that could take advantage of the information. This does fall into a kind of broad category of biomarkers, or the umbrella category of biomarkers. And usually with biomarkers, we think of three things for future goals. First is just being able to identify the different types of patients for what is going on right now in the day-to-day world of the physician, and raising the question for physicians, being able to stratify patients that way, is that of any help? And again, that's very much out of my range. It'll be up to physicians who care for these patients to assess this information and see whether currently it may be of use. The other area for biomarkers that's very common, or the other kind of next step, is a clinical trial. And a lot of times when there's a clinical trial that's meant to test a new drug, the results can be confusing. But if you subdivide the patients, so in our case, the patients with high tau versus the patients with low tau, you might see that the drug is very impactful for patients in one group or the other. So helping to inform clinical trials is another hoped for goal, again, that other people, not us, might be able to put on their list, that type of goal, people who know how to design clinical trials well. And then thirdly, there's a lot known about how tau does what it does because of its very extensive role in Alzheimer's. So again, there are people out there who know more than we do about what tau does and exactly how it works, and hopefully they'll pick up on this and they'll be able to look at it and say, oh, well, maybe this particular drug that's related to tau might be helpful in these cancer cases, or trying to design this particular therapy, given what we know about tau, might be a good bet, and we could apply that therapy to these particular cancers. So those three goals are very common for biomarkers, and again, that's kind of the umbrella that this falls under.
So your anticipated next step is to find a partner to take this to the next level.
Well, sure, that would be great. And if we can continue to help this topic out by bringing what we do know and the granularity of what we do know to the table, we certainly would like to do that. And this may be a good time to say make one extra point that we have had a chance to briefly talk about before. The work has been repeated by a group in Spain, and that does make us feel like it's something that is really ready for the next step. We certainly feel very comfortable about all the research we do, but it's the nature of the business that any original research has to be reproduced by others, and in this case it has. So yes, we're ready to help, and we feel very confident about an investment in the next step that could pay off.
And I understand you have a group of students that are very engaged in bringing this technology.
Yeah, certainly. I'm certainly happy to have the opportunity. That I would not be here. The information would not be available if it weren't for my students, who were the drivers with regard to this work and made it possible.
Thank you. We thank you for your time today. It's been very interesting learning about this, and we look forward to bringing you our next tech tour.